effects and emergency first aid. The name, address, and phone number of the nearest emergency medical help must be posted where you work. Be sure you know where this information is so that you can get help quickly in an emergency. If you look at a pesticide label, you'll see it has an emergency first aid section called the Statement of Practical Treatment. It's important that you read or have someone explain this section before you handle the pesticide, because you should know the emergency first aid procedures before you need to use them. If you do the wrong thing in an emergency, it could make you even sicker. It's a law that your employer must provide soap, a clean change of clothing, towels, and enough water to wash the pesticides off your body near the area where you are working. Do not use water from irrigation ditches and canals. Sometimes they have pesticides in them. If pesticides do get on your clothes and skin, take your clothes off right away and wash your skin with lots of soap and water. The faster you act, the less likely you are to get sick or injured. If pesticides get in your eyes, rinse them right away with an eye flush kit or allow a gentle stream of water to flow across them. Hold your eyelids open, rinsing your eyes for at least 15 minutes. If you breathe in a pesticide, get to fresh air immediately. Call for help, then sit down and try to breathe normally. Don't walk around if you're having difficulty breathing. If you must rescue someone who has inhaled pesticides and may be unconscious, make sure that you do not expose yourself to the pesticides also. Wear the appropriate respiratory protection and move the victim to fresh air. If that person is wearing a respirator, remove it. Loosen the victim's clothing and give mouth-to-mouth resuscitation if the person is not breathing and you have been trained in this procedure. To avoid getting pesticide residue on your mouth, place a clean cloth over the victim's mouth. If you swallow some pesticide, it is extremely important that you follow the first aid directions on the pesticide label. Read the label carefully. It will tell you whether or not to make yourself vomit. There are some pesticide labels that will tell you not to induce vomiting. These pesticides are corrosive and will cause further injury if you try to vomit. If the label tells you to induce vomiting, the best way is to put your finger to the back of your throat. If you're helping someone who has swallowed pesticides, never induce vomiting or give anything by mouth if the person is unconscious or having convulsions. Get your boss or a coworker to take you to a doctor if you swallow pesticide or get it in your eyes, if you spill any concentrate or a lot of diluted pesticide on your skin, if you have difficulty breathing, if your skin shows signs of burning, rash, redness, tingling, or blistering, or if you feel sick and think you may have been poisoned by a pesticide. If possible, have someone call ahead to tell the doctor the name of the pesticide, its EPA registration number, and how you were exposed. If at all possible, take the pesticide label with you to help the doctor determine treatment. If you must take the pesticide container, don't carry it in the passenger compartment of the car. Some people are allergic to certain pesticides. These people may get a severe skin rash when the pesticide touches their skin. They may also sneeze and have a runny nose or itchy eyes when they are near the pesticide. If a pesticide affects you this way, try wearing some extra protection, like goggles and a respirator. If these symptoms continue, you may need to stay away from that particular pesticide. An allergic reaction may not occur on your first or second exposure. However, your body may become sensitized to that pesticide. And if you are exposed to it again, you may have an allergic reaction. There are some harmful effects you may get from pesticides that won't show up for a long time. Studies on animals show that some pesticides may cause cancer or permanently harm body systems. Some pesticides may cause pregnant women to miscarry or have children with birth defects. Scientists don't know the long-term effects pesticides may cause, so don't take any chances. When you handle pesticides or work in areas where pesticides have been applied, do everything you can to keep them from getting on or in your body.